Okay, should I start?
Go ahead, Dr. Riyadh.
Okay. So this is a very good opportunity for us in the Saudi CDC to meet and introduce our institution for a respected healthcare institution in Saudi Arabia, and we hope this opportunity will lead us to more and more chances that we will have a very good dialogue between the public health institution in Saudi Arabia and all healthcare providers in the kingdom. So I prepared this very short introduction about Saudi CDC, but before I go to the details about the institution, it's very important to have a brief description about public health, because Saudi CDC is the leading public health agency in Saudi Arabia. Maybe some of you is already understanding public health. However, it's very important for us in public health institution to reiterate some concepts, some analogies, just to put in context our dialogue, and also to put you in, as they say, in our shoes, to understand the challenges that we are facing in public health and how the collaboration between public health and healthcare will lead to a better outcomes for the whole population. So I will talk about the public health, examples of public health issues that the global is facing now, and how to tackle this. A brief introduction about public health in Saudi Arabia, and then I will go to the Saudi CDC about our current situation, about our current governance, key functions, and our platform, and what we are planning to do in the few years from now. So what is public health? If you go to the history of the science, you will find multiple definitions, and it's let's say a challenging issue for us in public health, that multiple definitions, multiple understanding, and multiple context of public health is given with different countries and different systems and different populations. And this is the nature of public health, because there is, you will never find an identical society in all aspects, from political or social or cultural issues. And public health is dealing with these whole things together to achieve a health outcome. So this is a common definition: the health of the population, especially as the subject of government regulation and support. So it's dealing with the population as a unit of care, and that will be a very important distinction between public health and healthcare, as we will see. The other very famous definition of public health is the science and art of preventing disease, prolonging life, and improving quality of life through organized efforts. And this is again a very important terminology in our understanding of public health. It's an organized effort between all sectors in the society, and informed choices of society, organization, public and private, communities, and individuals. Okay, and there are certain analogies that we are using to define public health for the public, and also for other specialties that are not specialized in public health. You can understand public health versus healthcare like you understand the difference between the tree and a forest. Or you can use another analogy. You can use the upstream causes or interventions versus downstream versus. And also you can understand public health more if you put it in comparison with healthcare. So let me give you this example. And this is a very famous example all public health textbooks are using just to explain it, especially for the policy making. If you imagine a river, a very nice river with a very nice mountain in the top of the river, where people are going there just to see the very nice looking of of the site. But we have a very poor safety measures at that mountain. And then imagine you are a healthcare worker who are working downstream in the river, where you are dealing with recurrent cases of drowning people. Okay, so if you see this drowning patient, you will never spend time or thinking about the problem of the safety measures up there. You have to rescue this patient. And if you imagine multiple patients and multiple, let's say, cases, you will never have time or resources to put it there, to invest in safety measures there. You have to go to the traffic people, you have to go to the municipality people, you have to bring money from the financial people. All these efforts should come together just to go to that very nice mountain and put the safety measures to prevent more and more people from drowning. So if you replace this analogy with cases, with patients, let's say you have multiple asthma patients in certain hospital, and these the prevalence of these cases are much higher than a comparable society, and then you have to deal with those patients. They will come to your ER. You have to invest time and money. You have to train your physicians and your nurses to respond to different challenges for each case. However, if you analyze the community, you'll find a well-regulated factory who produce gases, and these gases elicit multiple cases, and these cases will have poor outcome in comparison to other people. So to solve this problem, you have to invest time and money to solve the problem with the factory. You have to relocate the factory. You have to bring people or investment to convince the regulators in the area that this factory, even if it is providing jobs for your people, it's harming your children. And these type of dialogue are very difficult. And those type of dialogue is the core business of public health entities worldwide. So this is another example for upstream and downstream interventions for obesity. For upstream, how can you tackle obesity in any country? You have to use regulations. Saudi Arabia introduced added sugar regulations last year with 100% increase from the previous point. You have to enforce food manufacturers to replace the very poor ingredients in their food with the better choices. And this is also a regulation. And all these regulations will cost money, and you have to invest in something called evidence-based policy. And it's very costly to bring lawyers, to bring regulators, and convince them with the science. And then after that, you'll put this in place and monitor the outcome. This is a very costly operation, and governments all over the world starting to put these things in front of other downstream interventions. Other example of downstream interventions. If you have a clinical dietitian who are dealing with one patient, this is a downstream intervention. If you have, let's say, a media campaigns, a small, like your medical city, you have a small campaign that nudge people to drink water, more water. This is a downstream intervention. And usually the downstream intervention will have a limited impact and limited outcome in an individual basis. But if you are dealing with, like in Saudi Arabia, we have more than 50% of our population who are obese or overweight. You have to go to the upstream level. And that's a core business of public health institutions. We analyze the data, we introduce legislations, and we monitor the impact of these legislations on the condition. In this example is obesity. Another way just to understand public health. Public health is interacting with the healthcare in different ways. We have similar goals. However, we are seeing the same picture from different angles. In public health, we have very huge interest in the public trust. We cannot enforce regulations or policies on the population when they don't trust these interventions. They have to understand it, they have to trust it, and they have to implement it. Okay, it's not that case in healthcare. Healthcare, if you have, let's say, admitted patient, sometimes the admitted patient will be in coma, and you have to take decisions as a physician. And the patient himself, the family of the patient is fully trusting you in deciding the best intervention for him. And the outcome of your intervention will affect only this patient. So the trust in healthcare is more in the qualification of the provider, in the qualification of the institution. And that's by high percentage will provide a very good intervention at the individual level. However, we cannot do the same in the public intervention. As we can see now in the example that I will provide you, we have a very huge successful public health intervention since 100 years, which is the vaccination. And people trusted the government that the vaccination is working and is safe. However, we started to lose this trust because multiple factors that healthcare and public health institutions did not give enough time to investigate and to provide another solutions to restore the trust. A lot of areas that healthcare and public health are sharing. Most important thing is the developing of the knowledge through clinical trials, through designing and testing the interventions, and also from the public point of view, we have a surveillance systems that will notify the government for the best intervention in the public interest. However, this notification system usually based on the healthcare facilities. So healthcare is notifying usually the public health institutions about all cases of public interest. This is a very, let's say, famous diagram just to understand the areas that overlapping between public health and primary health care. And you can see the care of quantum at the bottom of the picture. The more you go to the population level, and that's a public health intervention. And if you go to the left side, to the individual level, you'll start to have more healthcare interest, healthcare interventions, going from primary care to secondary care to the tertiary care. So these interactions are very important. And unfortunately, it's not well regulated and not well placed in a lot of in very many countries in the world, because usually governments, politicians, and people prefer the healthcare. They have more interest in the healthcare. They might be more happy if they have, let's say, a secondary hospital near their home, rather than a public health intervention to improve the food quality in the neighborhood. They don't recognize this. They don't see it. However, the government should understand this. The specialists in the healthcare and public health should understand this, and with common goals and common interventions and co-leadership in the achieving the goals, the population and the individual will have a better outcome. So this is a very let's say small example, just to give you a hint about how public health is entangled in the society, in the culture, and we are dealing not only with the biology of the body, which is the main focus of the healthcare, or the psychology of the individual, which is also a main focus in the healthcare. We have to deal with the public perception. We have to understand the root causes how people believe things, how people understand things, how people react to something. So in Saudi Arabia, we have a very good immunization coverage. More than 90% of our children is immunized. And this is very, very good outcome, because immunization is one of the earliest programs implemented in Saudi Arabia. And it was a mandatory to have immunization certificate to add your children to the family card. However, in Saudi Arabia and worldwide, we start to have this phenomenon which causes vaccine hesitancy, which is a very dangerous phenomenon. People started to question the safety and the reasoning behind the vaccination, and the conspiracy theorists putting all efforts just to convince people that these vaccinations do not work, and there is something behind it. And so, just last month, this is a Lancet paper published in September 2020. It was done and collected data from more than 140 countries with more than 284 subjects, and the main question was the confidence in the safety of the vaccines. And they track the confidence on the public level in those countries, and these are two examples. So in Indonesia, we have decrease in vaccine perception as safe intervention from 60%, 64% of the population to 50% in just 4 years. And this is a very huge reduction. And one of the reasons that people started to lose faith, because there was this very famous religious leader who issued a fatwa that vaccination contains a forbidden ingredient. So if you are a public health official in Indonesia, you have to deal with this. You have to sit with the religious people. You have to go with their logic. You have to convince them, because if you don't convince them, you'll lose people confidence. And if you lose people confidence, you'll start to have more cases. And your healthcare system will be strained with cases that might not happen if people did not lose their confidence. In Poland, this is another thing. It's worldwide problem. It's not only Muslim countries. In Poland, there is an organized anti-vax movement. People who are using Facebook, Twitter, to spread misinformation. And they lost also a huge percentage of their population confidence in the safety of the vaccination, from 64% to 53% in 4 years. So how people in public health institutions worldwide is dealing with this? And we are in Saudi CDC started to develop a task force just to deal with this. To address this, we must understand psychology of people, and this sociology also. We have to understand the economics, how poor people respond to these rumors versus high income people. You have to understand anthropology. You have to understand how people evolve through time, their contextual understanding of subjects. And all these things should come together with all stakeholders, from healthcare, non-healthcare, from education, from religion leaders, from everybody, just to put a policy to save public health. And that's the, let's say, the complexity of public health and the importance of public health. But this complexity, if you succeed in it, you'll have a very huge outcome, because one policy can save millions at a time. This is the logo of Johns Hopkins schools. Okay, save lives a million at a time, because one public health intervention can save millions of lives. So what about public health in Saudi Arabia? Saudi Arabia has witnessed a significant improvement in health indicators since its foundation in 1952 until now. We have a very good increase in life expectancy and other indicators. However, the advancement of healthcare is much, much higher than the advancement in public health. And that's a normal situation in newly founded countries when they started to take care about the healthcare at first, and then the public interventions will come later. However, even with huge advancement in healthcare, immunization, environmental sanitation provided the huge impact in improving the outcome of health in Saudi Arabia, which are public health interventions. From history perspective, the preventive services started in early 1950s with Aramco Oil Company. This is a very important company for all of us, even in public health. They started a collaboration with WHO to control malaria in Eastern region of Saudi Arabia. And from that, multiple programs followed to tackle leishmaniasis and other problems. And then that started to be contracted by the government in Riyadh. And then very important thing happened around 1992, where the Basic Law of Saudi state stated that the state takes care of public health and provided healthcare services for each citizen. So in our institution, constitution, like say, the Basic Law of Saudi state define public health and define healthcare, okay? And the government of Saudi Arabia recognized that the Saudi health system was built on curative orientation. But this is about to change with the transformation that is undergoing now. To achieve the Vision 2030 regarding the disease prevention and control, you have to focus on prevention and public health, and let the healthcare do its part through a collective action of the government. Okay, so this is very well known. In general, the whole government is mandated to ensure sound public health system. Public health authorities like CDC are established to provide the right and scientifically sound advices to the top leaders, you know, with variant other mandates with public health ecosystem. Public health ecosystem, in contrast to healthcare ecosystem, include major players outside health system. So in Saudi Arabia, we are dealing with MEMRA, which is Ministry of Municipality and Rural Affairs, Ministry of Environment, Water and Agriculture, Saudi FDA, Ministry of Education, Ministry of Interior, Ministry of Defense, Saudi National Guard, and Ministry of Transportation. All these things, or stakeholders, or let's say intersectoral players, are very important to achieve public health goals. And the role of Saudi CDC will provide the scientific, sound policies, suggestions for these sectoral players in public health. And you can see now that Ministry of Health as a regulator, or maybe Saudi Health Council as an umbrella of healthcare providers, are a very important stakeholder in public health ecosystem. So now this is about CDC. So the CDC was founded in 2013 with a Council of Ministers resolution number 200. However, it waited until 2016 when the Vision 2030 initiatives included activation of the CDC rule to be a national regulator for public health. And they assigned a generous budget for that goal. Okay, and CDC rule now is a reference authority of public health in the kingdom. So the CDC is concerned with preventing and controlling communicable, non-communicable disease, injuries, and other health threats, monitoring, measuring, and evaluation population health and related risk factors to inform policies and programs, as we described before, fostering the next generation of public health experts. And this is very important. And public health experts include healthcare experts who are trained in public health, and include non-health experts who are trained in, let's say, journalism, in lawyers, and health educators, and teachers. Everybody should have, let's say, a basic understanding how public health is working to achieve a good public health outcome. So this is our vision: a healthier life for all, and the term for all include all socioeconomic classes in the kingdom, citizens and non-citizens, even illegal, because you cannot have health only for selected persons in the society. And COVID-19 now is a lesson. COVID-19 do not recognize your legal status. You can be infected from a Saudi citizen or non-Saudi citizen or illegal immigrants. So that's very important. And fortunately, Saudi Arabia is recognizing this and providing services for all people who live on the soil of Saudi Arabia. So healthy life for all and global leadership in public health. This is our vision. So we look forward to be a beacon in the identity of Saudi society through our mission, which is promoting public health and reducing the burden of the disease through health legislations and systematic interventions in cooperation with everyone. So this is the governance. We have a board of directors led by the Minister of Health and with members from Ministry of Health also, Ministry of Education, Ministry of Municipal and Rural Affairs, Ministry of Water, Ministry of Environment, Water and Agriculture, and we have the head of Saudi Health Specialties, also a board member, and we have one expert from the King Faisal Specialized Hospital, and we have two international experts, which is the CEO, Director of Public Health Sweden Agency, and also the CEO of Public Health England Agency. So we have a very good and comprehensive board of directors who help the specialists in Saudi CDC to implement the sound policies. So the responsibilities of the board: approve the general strategy and operating strategy plans for the center, adopting performance indicators related to disease burden with internal and external organizations and bodies. So these are the specialties in the CDC: communicable diseases, which is the most pressing agent now because of the COVID-19. We are dealing with non-communicable diseases also. We have a special interest in health improvement and promotion. We are interested also in healthy environments and communities like health cities. We have multiple public health labs that provide very important information for public health policies. And we are building a new system for surveillance and preparedness. So this is again the key functions. One of the most important key functions is the global health. So CDC is a member in this global health agenda, representing the Saudi Arabia. And also in the plan of the transformation, we will take care of the international health regulations also. So this is the platform. I will be honored, and my colleagues, if you have a time just to visit these platforms and to give us insights and feedback, and just to spread these platforms. We have COVID-19 website. We have a laboratory accreditation program. All labs in Saudi Arabia who wanted to be accredited to provide the COVID-19 test, they go to this platform. We have a Twitter handle, and we have a YouTube channel, and we have a LinkedIn page also. This is an example of our work during COVID-19. We provided the risk assessment globally and nationally for the government. We introduced a ranking system for which country should we receive their citizen or not. We provided a recommendation about travel notice and the alert regarding the countries. We provided the de-escalation plan for travel restriction and the point of entry restriction measures. And the people from you who were outside of Saudi Arabia, when they came to the Saudi Arabia during the COVID-19, I think they noticed the Wiqaya logo on all the papers. Also, we provide a national risk assessment, monitor changes in which risk groups are most affected in order to better target prevention efforts, monitor the impact of any mitigation measures to inform stakeholders so they can adjust the choice of measures as well as their timing and intensity. So our specialist people are dealing with multiple stakeholders within the Saudi government, including the education and the Islamic affairs, and all the measures that you are facing now were recommended through a scientific committee in the CDC. This is a detailed description about the key function in the center: epidemiology, surveillance, and response. And multiple initiatives within these contexts are under developing. CDC is still We consider ourselves a transformation entity. We have a plan that the full maturation of the system of public health, including the Saudi CDC, will be around 2025. However, multiple interventions started right away, started from 2019. These are some of the interventions and efforts by our departments during COVID-19. We issued more than 100 guidelines for different, let's say, community activities like schools and masjids and malls. All these guidelines were issued by scientific committees in the CDC. Also, Public Health Lab is providing the test. We were the only central lab in Saudi Arabia from maybe early March until 3 months later, who provided the tests for the new cases. And then we started to delegate these functions to other accredited labs. So in the coming 2 years, or maybe 3 years, we have 2 major initiatives that will be a very important initiative, will shape the public health for the coming 20 years. We are writing a public health law. Unfortunately, in Saudi Arabia, we don't have a public health law. We have a health law, which include multiple aspects of public health and healthcare. However, best practice worldwide to have a dedicated public health law or public health laws. Sometimes you have multiple laws because public health is very wide. However, in Saudi Arabia, we started to draft a public health law that will address multiple issues in public health in Saudi Arabia, including the interaction between public health and healthcare. And we hope this project will be ready by the end of 2021. Also, Saudi CDC is still a center in the environment of Ministry of Health. We're still officially linked to the Ministry of Health. However, under the transformation, we will be independent entity, and that's also will happen in the few coming months. We are in the final stages of the process, and that will enable the Public Health Authority, which is the CDC, to deal with MOH and other ministries as stakeholders within the context of public health. However, we understand that the healthcare is the major and the single most important player in delivering the public health interventions, and also in helping us to understand how the public health interventions are impacting people on the individual level. So thank you for your time. I'm honored to be presenting in front of your prestigious staff, and I hope I provided a small introduction about the CDC. And if you have any questions or something, I would be happy to answer it before ending of the session. Thank you.
Thank you, Dr. Riyadh. It's really a fabulous work. أنا نيابة عن رئيس القسم أهنيك وأرحب بك مرة ثانية في قسم الأطفال. وقبل ما نفتح الفلور للكويشن, everybody has a question, he has to raise his hand عشان just to regulate the meetings. Otherwise, I will start myself.